Hi, my name is Dr. Matt Lawless, bringing you another knee moment from Knee Fit and 5 and MSM products. Joe writes in from Indiana asking, how do I keep my knees healthy as I get older? I was a former athlete, played a lot of football and track, and never had any serious injuries to my knee, but I'm just worried that I might be leading myself to knee pain. Great question, and I'm asked that very frequently. Obviously, as we get older, our cartilage starts to degenerate. We're more prone to meniscus tears and other injuries to our knee. The best way to keep your knee healthy with time, though, is to keep as skinny as possible. Keep your BMI as low as possible. The BMI is a body mass index. It's a scale, a number that is related to your height and weight. Normally, we like to see it under 25, but certainly under 30. So keeping your weight down does help knee pain, knee arthritis, and preventing some of those. People that are heavier have a higher chance of getting knee arthritis. So the first thing to do is stay as skinny as possible. The second thing to do is to not let your knees get stiff. Make sure you always keep their full extension. By full extension, I mean equal extension to both sides. Remembering that most people have hyperextension, that probably means hyperextension. Guys have about 4 or 5 degrees of hyperextension, meaning their knee goes backwards a little bit. And women seem to have a little bit more, maybe 5 or 6 degrees of hyperextension. So keeping full knee motion, full extension and full flexion, so the straightening and bending, and also keeping strength. As we get older, we have a tendency to do less and become weaker with time. People that maintain their strength seem to do much better through the years and seem to have less knee pain. Even if they do develop arthritis, then they will do much better keeping full motion and keeping their strength up. If you have two people, one that's sedentary, one that's active, both with knee arthritis or meniscus tears or whatever other pathology in their knee, the one that has good motion and good strength hurts much less than the one that gets stiff. So in summary, if you want to help avoid knee pain, stay skinny, get your motion, and keep it strong, keep it functional, keep using it, regular exercise. Thanks.